Hello dear learners. Through this video, we will learn about improvement in rural sanitation. In this video, we will learn about the term sanitation, concept of sanitation and hygiene, why sanitation and hygiene are important to consider, why rural sanitation is challenging to maintain, how poor sanitation impacts us. What is the vision of the Government of India behind the programs and policies of proper sanitation? And how do governmental bodies play their role in maintaining sanitation? Different measures and programs to improve sanitation. And in the end, how NGOs play their role in improving sanitation and hygiene. Let us start with what sanitation is. Sanitation is the hygienic means of promoting health through prevention of human contact with the hazards of wastes as well as the treatment and proper disposal of sewage and wastewater. Individual health and hygiene are largely dependent on adequate availability of drinking water and proper sanitation. Therefore, we can see a direct relationship between water, sanitation and health. Improper disposal of human excreta, improper environmental sanitation, and lack of personal and food hygiene have been major causes of many diseases in developing countries like India. In this context, Government of India launched Central Rural Sanitation Program, CRSP, in 1986. Primarily with the objective of improving the quality of life of the rural people and also to provide privacy and dignity to women. Next is the concept of sanitation and hygiene. Sanitation was earlier limited to disposal of human excreta by open ditches, pit latrine, bucket system, etc. But later on, it is expanded to personal hygiene, home sanitation, safe water, garbage disposal, excreta disposal, wastewater disposal and many more. And today it connotes a comprehensive concept which includes liquid and solid waste disposal, food hygiene, personal hygiene, domestic hygiene and environmental hygiene as well. Now let us look after few statistics that depicts why proper sanitation and hygiene carries so much importance. Diarrhea stands as the second most prevalent cause of death among children below the age of 5. Each year, diarrhea kills around 5,25,000 children under 5. In 2020, 6,70,315 deaths occurred due to diarrhea in India alone. And it is interesting to know that each gram of wet faeces contains nearly 100 billion bacteria, 50% of which are alive, 100 million to 1 billion viruses, and 100 million archaea. Poor sanitation is not only responsible for the disease but also capable of exposing females to risk of assault during open defecation. Maintaining sanitation is crucial, but in rural areas it is more challenging. Because in villages most of the people still defecate in the open space, most of the villages lack waste disposal and drainage systems, and many in the villages are ignorant about the consequences of poor sanitation and unhygienic conditions. As a result, many people suffer and even die of diseases caused by unhealthy practices of personal and environmental hygiene. Let us understand the impacts of poor sanitation in detail. Poor sanitation affects health, women's safety, education and productivity chiefly. Open defecation plays a primary role in polluting water sources, and the communities dependent on these sources reaches to several health hazards. It is also responsible for spread of air and vector-borne disease. Practice of open defecation exposes women to risks of sexual assault. Women often wait for darkness to descend before venturing out to relieve themselves. Holding in for long periods causes diseases and adversely impacts health. Girls are reluctant to attend school, and parents are disinclined to send them if there are no safe, private toilets for them. Many girls are forced to miss class during their menstrual cycle. The economic deprivation increases manifold when healthcare expenses and the cost of lost potential due to sickness arising from inadequate sanitation is added. Before discussing the different programs and policies for rural sanitation, here is the vision of Government of India behind maintaining proper sanitation and hygiene. All Indian cities became totally sanitized, healthy, livable, and ensure good public health environmental outcomes for all their citizens with a special focus on hygienic and affordable sanitation facilities for poor. Role of government bodies in maintain sanitation. The task of ensuring sanitation facilities in India is distributed, primarily held by local governmental entities. In rural regions, this responsibility lies with the Gram Panchayat, whereas in urban areas, it's managed by municipalities or corporations. Both the state and central governments play a facilitating role, which involves creating supportive policies guidelines, offering financial aid and capacity building assistance, and overseeing the advancement of initiatives. Within the central government, the guidance for sectoral investments is channeled through 5-year plans, overseen by the Planning Commission. These plans allocate funding to strategic priorities within the sector. Let's look after different measures that are takes to improve sanitation in rural areas. First is the Environmental Hygiene Committee formulated in 1948, which recommended that 90% of the country's population should be covered with water supply and sanitation facilities within a period of 40 years, for which the national program was to be initiated. Second is Introduction of Sanitation Program in the Health Sector, 1954. Third is National Water Supply and Sanitation Program. It was launched as part of the first 5-year plan, 1951 to 1956, which had a provision of 6 crores rupees for rural water supply and sanitation programs. It was envisaged that 25% of rural population would be provided with sanitation facilities by the end of the 7th 5-year plan period. Fourth is transfer of Rural Sanitation Program to the Department of Rural Development from the Ministry of Urban Development in 1985. Fifth is program to construct 1 million sanitary latrines in houses of SC and Cent. In 1986, the program was launched under Indira Awas Yojana, and to provide 250,000 additional latrines to health centers, schools, panchayat ghars and Anganwadis under National Rural Employment Program and Rural Landless Employment Guarantee Program. After this, rural sanitation was included under the Minimum Needs Program MNP in 1987. Let us discuss few of the rural sanitation programs in details. Starting from Central Rural Sanitation Program, CRSP. It is a centrally sponsored rural sanitation program, launched in 1986. It is implemented in different states and union territories for improving sanitation facilities through construction of sanitary latrines for individual households. The program provided 100% subsidy for construction of latrines for SCs, STs and landless laborer and subsidy as per the rates prevailing in the states for the general public. Main objectives of Central Rural Sanitation Program are to improve the quality of life of the rural people and provide privacy and dignity to women, to provide sanitary latrines to the SCs, STs, landless laborers and people living below poverty line, to provide clean, healthy and environmentally acceptable disposal of excreta with a view to create good sanitation and consequent improved health standards. Here are certain revisions that happen in Central Rural Sanitation Program. The criteria and norms under CRSP were modified in February 1991 and the guidelines were revised again in June 1993. The purpose of revision was to make the program more holistic, to give emphasis on information, education and communication activities, to involve voluntary organizations in a bigger way. Program also introduced the concept of sanitary mart. The subsidy pattern has been changed, limiting to 80% for persons below the poverty line for individual household latrines. The unit cost of construction is to be limited to 2,500 rupees, of which 80% could be paid as subsidy to the selected beneficiaries below the poverty line. Another salient feature is to develop at least one model village covering facilities like sanitary latrines, conversion of dry latrines, garbage pits, soakage pits, drainage, pavement of lanes, sanitary latrines in village institutions, cleanliness in ponds, tanks, clean surrounding around hand pumps and other drinking water sources. Another program is Total Sanitation Campaign, TSC. It was launched after restructuring Central Rural Sanitation Program and initiated on 1st April 1999 under sector reform process and is operational in 451 districts. Components of Total Sanitation Campaign are: construction of household latrines, sanitary complex for women, toilets for schools, balwadi, anganwadi, etc. It also provided funds for startup activities, information, education and communication and administrative charges. Objectives of Total Sanitation Campaign are: to bring about an improvement in the quality of life in rural areas, to accelerate sanitation coverage, to generate demand through awareness and health education, to cover all schools and anganwadis in rural areas with sanitation facilities and promote hygiene behavior among students and teachers, to encourage cost-effective and appropriate technology development and application, and to endeavor to reduce water and sanitation-related diseases. Features of campaign are: greater household involvement and participation, technology options as per choice of beneficiary households, stress on information, education and communication as part of the campaign, emphasis on school sanitation, women sanitary complexes, integrating with various rural development programs, involvement of NGOs and local groups, promoting access to institutional finance and social marketing concept. Next program is Nirmal Gram Puraskar, launched in 2003 and gives reward for 100% sanitation. It was constituted to involve elected local representatives of Gram to promote collective community action through sanitation. They were given to districts, blocks and Gram Panchayats that have achieved 100% sanitation coverage of individual households, 100% school sanitation coverage and free from open defecation and clean environment. In this, an amount ranging from 50,000 to 5 lakhs is given. On 24th February 2005, former President of India, Dr. APJ Abdul Kalam gave away NGP awards 40 Gram Panchayats from 6 states for open defecation-free status under the scheme. In this slide you can see the amount of incentive which ranges between 50,000 to 50 lakh rupees under Nirmal Gram Puraskar program on the basis of population distribution. Another program is Nirmal Bharat Abhiyan. It was initiated in 2012 after Total Sanitation Campaign closed in 2012 after striving for 13 years in achieving universal rural sanitation coverage. It is a community-led and people-centered approach which emphasized on a new approach of awareness by linking it with the current sponsored schemes of government. It has been initiated with a clear-cut strategy to make grassroots institutions as focal points and integrate planning and implementation of sanitation. Under this program, brand ambassadors are identified to undertake nationwide campaigns on water, sanitation and hygiene issues. Vision of NBA is to bring about an improvement in the general quality of life in the rural areas. Accelerate sanitation coverage in rural areas to achieve the vision of Nirmal Bharat by 2022 with all Gram Panchayats in the country attaining Nirmal status. Motivate communities and Panchayati Raj institutions promoting sustainable sanitation facilities through awareness creation and health education. To cover the remaining schools not covered under Sarv Shiksha Abhiyan (SSA) and Anganwadi centers in the rural areas with proper sanitation facilities and undertake proactive promotion of hygiene education and sanitary habits among students. Develop community-managed environmental sanitation systems focusing on solid liquid waste management for overall cleanliness in the rural areas. Next major program is Swachh Bharat Mission. It is a national campaign by the Government of India covering 4,041 statutory cities and towns to clean the streets, roads and infrastructure of the country. The campaign was officially launched on 2nd October 2014 at Rajghat, New Delhi, by Prime Minister Narendra Modi. It is India's biggest ever cleanliness drive and 3 million government employees and school and college students of India participated in this event. It aims to eradicate open defecation by 2019, thus restructuring the Nirmal Bharat Abhiyan by constructing 12 crores toilets in rural India at a projected cost of 1.96 lakh crore. The program has also received funding and technical support from the World Bank, corporations as part of corporate social responsibility initiatives and by state governments under the Sarv Shiksha Abhiyan and Rashtriya Madhyamik Shiksha Abhiyan schemes. An amount of 90 billion was allocated for the mission in 2016 Union Budget of India. Government and the World Bank signed a $1.5 billion loan agreement on 30th March 2016 for the Swachh Bharat mission to support India's universal sanitation initiative. Along with government, NGOs also plays a vital role in improving the sanitation and hygiene. NGOs raise awareness about sanitation benefits and risks, using campaigns and workshops to educate rural communities. They promote proper sanitation practices like toilet usage and hand washing, encouraging healthier behaviors. NGOs train communities and officials to plan, implement, and manage sanitation projects effectively. They collaborate with locals to build toilets, waste systems, and treatment facilities tailored to the area. NGOs influence policies and resource allocation, pushing for prioritized rural sanitation. NGOs facilitate collaborations between government, organizations, and communities for more impactful initiatives. They track project progress, health impacts, and behavior changes, adjusting interventions accordingly. NGOs test new technologies and methods, conducting research to develop context-specific solutions. They provide quick sanitation solutions during disasters, preventing disease outbreaks, and engage communities for lasting impact, fostering ownership and responsibility for continued success. Dear learners, don't forget to subscribe and ring the notification bell to stay updated on our latest videos.